Okay.
Hello and good morning mga arthritis warriors. I am Dr. Jonathan Flordelis and you can call me Dr. Joff, and I have a very special guest for today. Sir, please introduce yourself.
I'm Doc Florian, chiropractor in the Philippines.
Okay, so Doc Florian, can I call you Doc Flo?
Yeah, of course.
Okay, Doc Flo. This is very interesting because most Filipinos think chiropractors, they just crack backs. What's the one thing that you want to tell our viewers that you wish the Filipino people understood about your practice?
So, chiropractors are literally doctors. That's the first thing I want them to know. Specialists for the spine. So, within the spine, you will have like the nervous system with all the nerves. And the chiropractor is helping your nervous system working on your spine. That's what I would like them to remember, and that will help in so many ways by, for example, having a better posture, having better movement, or having less pain. That's the kind of thing I would like them to remember of us.
Because if the patient with severe back pain goes to an orthopedic surgeon, especially one who specializes in the spine, and this patient has had years and years of severe back pain, once we see something on X-ray and MRI that may be a pinched nerve, a lot of the surgeons would advise surgery. What's the usual thing that maybe the surgeons miss that chiropractors can see?
Okay, so it's a completely different approach, actually. So, for example, you will go to visit the orthopedic surgeon most of the time because you have a severe pain. You will not go to visit a surgeon because you have a discomfort. And I don't think you will often advise for a surgery. You are not a spine specialist, but still, like, you will not advise a surgery if the problem is minimal, right?
Yes.
Same as me, like, I will not, if the problem is super big, advise for chiropractic. So what will I do is, like, for example, let's make a concrete example. For example, Doc Joff, you are like a surgeon, and that means that you will have to stand for hours over like a body that you will literally like make a surgery, operate on. So that means you need to stand for hours. And I already saw you practicing. I already have a surgery under your hand. And so I remember that when you were starting, you were like standing pretty straight. You were efficient. And gradually you started like 99 to do like this. So that is super normal. We can imagine the same for someone working in an office. At first you start your day like this, and in you think about that. Your back muscles get tight or tired, and because of that you will start to have like it can be a bit asymmetric. It will most of the time lead to the head going forward, and that is really something common, and that is showing that you don't have an optimal nervous system. So my job will be to literally work on your spine in order, for example, to make these muscles more efficient. Thanks to that, you can stand more easily. You will get less tired by standing, and you will be able to stand longer time before starting to do this type of thing. So that's what a chiropractor do. That's why you visit a chiropractor. The surgeon will not focus mostly on that.
And I'm very curious, what is the majority of the diagnosis that you can identify that maybe the other doctors, even if this patient has had multiple doctors, the doctors sometimes miss, but you can find?
Oh, so there are many actually. Like
the most common.
I have like a few examples of ones that were difficult to find, but the most common will be to know exactly what is causing the pain. Meaning not just showing like, okay, the surgeon will tell you, for a surgeon or the orthopedic doctor will tell you like, okay, you have this joint that is damaged because he see it on the MRI, because he has a few tests that are showing this is the joint that is painful. But he doesn't really know what caused that? What is the root cause behind that? So that's the goal of the chiropractor, to understand what is causing that. For example, can it be like a childhood trauma? Can it be like because you were young, you fell down from a carabao? Like it can be for so many reasons actually. And my goal will be to identify the cause, to try to gradually remove it and avoid the problem to come back.
Okay, so that's very interesting. Thank you for that, Doc Flo. Now, educate us simply about the science that you mentioned. The nervous system, the spine, and the muscles are something that need to be coordinated.
True.
Because I want you to talk about this. As we age, we feel more of this, but as children, maybe not so much.
That's true. That's true. I think most of the people discover the low back pain or neck pain rather late. But nowadays, I think that it's much and much earlier because we are spending more time in front of computer. We are less active than back in the days. So yes, nowadays for sure we will discover it younger and younger. So the thing is, when you have an optimal nervous system, you will have like better motion, less pain, and you will have a better posture. That's really what the nervous system is controlling. So if I make your spine very like optimal, you will have a optimal function of your nervous system. So as I was saying, that will really help you to stand straight, for example, but not only that, you will also breathe better. Let's say you can even get you will get less tired. You will be like really in a better wellness. That's really what is important to say about chiropractic.
For the arthritis warriors who have issues in maybe their hip arthritis or knee arthritis, how does the spine and affect the joints, the nervous system, and the muscles that you treat?
So you have many consequences by having a better spine, including also, it can also help with some other joints, of course. But let's say that you will have also let's imagine you have hip arthritis on one side. It will start like, you will start to put less weight on the leg that is affected than on the other one. So that will make a kind of tilt of the pelvis that will have consequences on your spine. So that can be on the thing. But you can imagine also the opposite. If you have like a scoliosis, a curve, your pelvis will have to tilt to follow the shape. This one is hard to visualize for the arthritis warriors, but you have to imagine your pelvis will follow your spine. So because of that, you will have a joint on the hip that will get more damage than the other. That's one of the consequences. So if I work on your pelvis to try to balance it a little bit more, you will have less of these consequences. But also the chiropractic can directly help with the joint itself, because I work directly on the joints by giving it more mobility, by working on the muscles around. And that's how we can help, for example, the athletes.
And you mentioned things that are accelerating the aging of the spine. As Filipinos who are doing a lot of laptop or cell phone, sitting down maybe in a call center or at home, what is this doing to their spine in your opinion, these activities?
So it's actually, at first, it will make some muscles tight. That's gonna be one of the first steps. Like for example, I'm sure if I start working on this one, it's not enjoyable when I am doing that on you, because some of these muscles are overstimulated to keep you standing, to keep you straight, to avoid your head to fall down like that. These muscles have to work a lot. And so that's gonna be one of the first signs that you can notice. Like you have always tightness here.
We call it panuhot.
Oh, do you have a word for that? Oh my gosh, I never heard that. I'm a little ashamed.
Some people will call it knots in the muscle, knots or tightness.
This one, yes.
Yeah, but we in Cebu, a lot of people say panuhot.
Panuhot.
Yeah.
I could add that to my questions. So that will be one of the first signs, but in I, you can start to develop some other little symptoms. Like one of the most famous for a chiropractor will be like first a little pain, discomfort here, that will at first be usahai, like sometimes, and gradually more and more often. And at the end, towards the end, it can even lead to many other conditions like radiculopathy, meaning pain in the arm, or even pain in the scapula. So you can have many consequences from that. But the first one is this tightness in the muscle, very famous.
And I want you to give our audience the best 3 tips that you can share with us on how
That's a good question.
we can prevent or maybe improve our spine and our nervous system, in your own opinion, of course.
Okay, so that are not chiropractic related at all. I would say like the first thing will be to have a very good working place that is really organized for you and for nobody else, meaning the height of your laptop, like you need to be like aligned in order. Of course, if your computer is here, like right now, we will have to go there. Of course, you will not be able to have a long run like this. That's the first tip I would give. Second one is about like your own lifestyle. Like you need to have nice eating, nice sleeping. That sounds simple, but that is super important. That will help a lot. Nice food, like not too much transformed food. I know that you are fighting against this kind of bad habits in the Philippines. Very important, and we thank you for that. So it's really important to have a good lifestyle. It helps a lot. And to finish, it's the one I didn't find the solution, but decrease the stress. Decreasing the stress and the pressure, because the stress causes tightness a lot, and it lower your ability to resist to the pain. That means that, let's imagine something that should not be painful usually. If you have a lot of stress, everything's gonna be painful. You will feel your body so bad. So that's one of the tips I could give. Not easy, this one.
My last question for you is that, should patients go to chiropractors first or rehab doctors, orthopedic doctors first? What is it for you?
Okay, so for the physical therapists, it will depend on the skills of the physical therapist. Most of the time you will need to meet a doctor specialist, like your brother, for example, that will give the instructions about to what work on, like what type of exercises are fitting the best to the patient. The chiropractor, it will be like, he will be able to detect and address the conditions right away. So that's a good thing. You don't need to visit a doctor first that will tell the instruction, and after the chiropractor will help with. I am able to detect and to work on some of the things. And so when to visit a chiropractor, but if you don't have any pain, that you are just like curious about your condition, like we come with the x-ray, so you will have really a lot of indications about what's going on in your spine. So same as an orthopedic, but what is interesting with that is you don't need to have pain. I will try to make your nervous system optimal, and you will already feel a difference even if you don't have pain. And after, if you have pain, like when it's mild, you will, as I said earlier, you will not visit a surgeon right away. It's not your first mindset, right? So a chiropractor is the good help for that. And to finish, I know that you, Doc Joff, that was one of the things I really enjoyed about you. One of the first advice you give to the patient is you need to collect some other opinions from some other surgeons or doctor before you make your decision to go with the surgery, for example. And I really appreciate that, because that's something I advise as well to my patients when they are big, when they have a big case, like when they have a big troubles. I will tell them, okay, I give you this possibility of treatment, okay, with that many sessions, that cost, and I really advise you to visit also a surgeon in order to collect his opinion and to make a comparison, because there are advantage to surgery compared to chiropractic in some cases, and sometimes it's the opposite. So you need absolutely to have every information in order to make the best decision. So there is no rule.
That is perfect. Doc Flo, thank you so much for your time. You gave great advice. especially the laptop, and of course,
You recognize yourself, I'm sure.
yeah, if you have a cell phone, posture, the table, that was really great. But you forgot to mention where they can find you.
Oh, that's a good question. I was about to forget that. That's true. So, actually, you can find me by typing that. I don't know if it's very visible, but
Chiropractic Flow.
exactly,
Yeah.
Chiropractic Flow. You can find me on Facebook, and my name is Doc Flow. So always with the same W at the end, and you can find me on Instagram as well by the name Doc Flow. And so I'm literally working across the street here. So we are at Streetscape right now, and I'm working in other medical, aesthetic, and wellness clinic that is located near the entrance of Maria Luisa. So you can find me there every day.
And thank you so much. So, mga arthritis warriors, that is all the time we have for now. I'm Dr. Jonathan Flordelis, and our guest, Doc Flo, has given great insights about chiropractic care. I hope you follow us for more tips and more information. Let's educate, inspire, and heal others. Bye-bye.
Bye.
So that's wrap for part 1.